Welcome back to MLT 120 again. Today we're going to talk about different diseases that can affect your white blood cells. These are diseases that are not inherited, and this lecture is going to be in two parts. The first condition we're going to talk about is infectious mononucleosis. It's also known as just simply mono or the kissing disease. It's caused by the Epstein-Barr virus, and we usually see an increase in our white blood cell count with this condition. We usually see an increase between 10,000 to 30,000 white bloods per microliter. Remember, our normal white blood cell count is between 4,500 to 11,000 white blood cells per microliter. In infectious mononucleosis, we usually see lymphocytosis, which is an increase in our lymphocytes. We see a markedly increase in our active lymphs, and remember there's a difference between an active lymph and a normal small lymph. And remember, the active lymphs can take on this holly leaf shape and they're larger. The holly leaf shape being that has these scalloped edges indicating that it's active. See, this is the smaller inactive lymph to have kind of for comparison for images. When they're in that active and large state, your lymphs can be referred to as downy cells. Okay, remember that active lymphs can also be referred to as downy cells. Now, in infectious mononucleosis or mono, patients can develop heterophile antibodies. So what does heterophile mean in this instance? It means that those antibodies can start having affinity or love for antigens other than their specific antigen. Remember, we learned that antigen antibodies are kind of like a lock and key system. A specific antigen belongs to a specific antibody. But in this instance with infectious mononucleosis, that relationship kind of is not as defined. So heterophile antibodies start linking up with antigens that are not specific for that particular antibody. Usually this disease happens in young adults. Common symptoms include fever, lymphadenopathy, which are enlarged lymph nodes, fatigue, a sore throat. Some less common symptoms include hepatomegaly, which is an enlarged liver. In some patients, you have increased liver enzymes and bilirubin, hemolytic anemia, and also thrombocytopenia, which is decreased platelets. This slide is just going over some of the different symptoms that go along with infectious mononucleosis. Also, you can see what the Epstein-Barr virus looks like. The pharyngitis is just another way of saying that mononucleosis causes sore throat. You can see the swollen lymph nodes there. Also, you can see the comparison of the active lymphs, which can also be referred to as atypical lymphs, versus the normal lymphs that you'll see. Remember, you'll have a marked increase of your active lymphs. Also, it can cause problems with your liver. Also, enlarged spleen can also result as a symptom of the Epstein-Barr virus. Here are a few practice questions that go along with infectious mononucleosis. You might want to pause the video at this time and try to answer them on your own before we go on in the video and I give you the answers to these questions. So first question is, name the virus that causes infectious mononucleosis. Of course, that's the Epstein-Barr virus. Next question, although infectious mononucleosis is a viral disease, what do we notice about the total white blood cell count? It is increased. Question C, name the antibody produced in patients with infectious mononucleosis. It would be a heterophile antibody. And the final question is, what is a downy cell? A downy cell is just another name referring to a reactive lymphocyte. The next disease we're going to talk about is systemic lupus erythematosus, or just for short, lupus, or sometimes it's referred to as SLE. Before we get down into what lupus is, let's just look at the word erythematosus. The first part of that word comes from the Greek word eros, and that Greek word eros means red. And you'll see where the red comes in here in a minute when we're looking at symptoms. But lupus is an autoimmune connective tissue disorder, and you'll primarily see it in women. And one way that we use to detect or diagnose the presence of lupus is the presence of what we call a LE cell. An LE cell is a neutrophil or a macrophage that has phagocytized or engulfed denatured material of another cell. So if you'll look over here, this is an example of what a LE cell is, or a lupus erythematosus cell looks like. And this is a example of a neutrophil that has engulfed denatured material of another cell. So here is the nucleus of that neutrophil kind of smushed up to the side of the cell because it has engulfed material of another cell. We don't use this method as much now. Here is some actual cells that you would see under the microscope, some actual LE examples that you could see under the microscope in a patient sample with lupus. But now we usually use what we call an ANA blood test to help diagnose lupus patients. And the ANA stands for anti-nuclear antibody test. Okay, here's a couple images showing symptoms of lupus. Here is one of the main symptoms that you'll see with lupus patients. This is what we call a butterfly rash across the face. And again, you'll see lupus more in women than in men. So here is that red arrows, red butterfly rash across the face. You could also see hair loss, ulcers in the nose and mouth, headaches, high fever, problems with lungs, kidneys, pain in the muscle and joint, blood, problems with anemia, problems with blood pressure, also problems with the heart like endocarditis. So there's several things that could go on, or symptoms that a lupus patient could suffer from. Next up, we have the Letter-Sawi disease. It is a group of symptoms caused by the LCH, which is the Langerhans cell histocytosis. The Langerhans are the tissue cells. Doctors generally do not diagnose Letter-Sawi disease as a distinct syndrome anymore. Instead, they simply diagnose the Langerhans cell histocytosis. The LCH is a disorder that affects the Langerhans cells, or the tissue cells, which are immune system cells classified as dendrites. And dendrites are monocytic, antigen-presenting white blood cells. As a type of white blood cells, these dendrites or cells normally signal the presence of infection to other parts of the immune system. Letter-Sawi disease usually affects children, and it usually arises between 2 to 3 years of age, but adults can develop the disorder. It's just not as common in adults. Usually symptoms include skin lesions that are scaly, eczema-like, or sometimes have purpuric rashes. And what does that mean? These are rashes that cause red or purple looking rashes. And the rashes involve the scalp, ear canals, abdomen, neck, and face. And you can see an image of a little baby with Letter-Sawi disease here on the left-hand side of the slide. Now I'm going to jump down to the bottom of our PowerPoint and cover the lipid storage diseases. I'm going to do this because I don't want to break up any of our lymphomas. I want to make sure they're grouped together in our part 2 of this PowerPoint lecture. So the lipid storage diseases are caused by deficiencies in enzymes needed for the breakdown of lipids. There's 2 diseases in this category that we're going to talk about, and the first one is the Gaucher disease, and it doesn't sound like it looks because it is actually a French word, so it's pronounced Gaucher. In Gaucher disease, since there's an enzyme missing to break down lipids, lipids start to build up in the liver and the spleen, so it starts to cause problems for your liver and the spleen. So where's the deficiency? The deficiency is in the enzyme beta-glucadase, which leads to unmetabolized glucocerebrosidase in the cells. So what is the glucocerebrosidase? It is a lipid building block of the cell membrane. So where does this unmetabolized glucocerebrosidase in the cells take place? It mainly takes place in the monocyte macrophage system, and this disease can be inherited, and you can see what cells look like in the Gaucher disease. You will find these cells in the bone marrow. You have a huge histocyte with a displaced nucleus. You can see it's off to the side. The cytoplasm, they say, has a wrinkled tissue appearance. Okay, so if you were to take a piece of tissue paper and crinkle it up, that's what they say that the cytoplasm looks like in Gaucher disease. The next disease we're going to discuss in the lipid storage diseases is the Niemann-Pick disease. This one affects the ability of the patient to metabolize lipids within the cells. It can affect the brain, nerves, liver, spleen, bone marrow, and even the lungs in severe cases. It is an inherited disease. It's recessive, so both parents must have it to pass it along. It can affect patients of any age, but it usually does affect children more. And there's actually 3 types. There's a type A, type B, and type C. So what is the deficiency? The deficiency is of the sphingomyelinase, which causes accumulation of the sphingomyelin and cholesterol. And this is a serious disorder because we have no known cure, and sometimes it can be fatal. The Niemann-Pick cells can be found in the tissue, organs, and bone marrow. The appearance of the cells are said to be foamy looking, or a foamy macrophage, and you can see what one looks like here in this image. The nucleus is off to the side, but it has a very foamy appearance to the cytoplasm. Here's just a couple of questions on what we've learned about the Gaucher disease and also the Niemann-Pick disease. I would pause the video at this time and try to answer them on your own before we go over the answers to the questions. For both conditions, what are the enzyme deficiencies? For Gaucher disease, the enzyme deficiency would be with the beta-glucadase. For Niemann-Pick disease, the enzyme deficiency would be for the enzyme sphingomyelidase. Now for both conditions, you need to describe how the macrophage is going to appear in bone marrow. Well, the biggest difference between the 2 cells is going to be in the cytoplasm. For Gaucher disease, the cytoplasm is going to appear as wrinkled tissue paper. For the Niemann-Pick disease, the cytoplasm is going to have a foamy appearance. This concludes part 1 of this lecture. I will see you over in part 2.